So number one, what is downtime like? So thankfully, compared to a surgical rhinoplasty, which has a long downtime, this has zero downtime. Basically, we're adding filler. You see it immediately. It does require a touch up, usually depending on who your injector is. I usually have my patients come back in about 2 weeks. The biggest thing though is I want you to avoid using glasses or goggles in the area for about a week or so, just so things can mold in and stay put before you move it around. Question number two is how long it lasts. So this is really interesting because it actually lasts a little bit longer than if we put the filler in the cheek, just because it's not a really dynamic and moving area. So it typically lasts about a year and a half. Usually it does require a touch up with a full, other session in about a year or so. And then after that, it actually stays put for a few years. So you're pretty good. So yes, it can be a little expensive. Costs include, usually it's about 2,000 to 3,000 depending on where you go, with a really good injector, which I usually recommend. So this leads me into your third question, which is who performs a non-surgical rhinoplasty? Given this procedure is fairly risky, there's an important artery that goes through the nose into the eye, so you can get necrosis, you can get even worst case scenario blindness, which has been reported from this. You want to make sure your injector really knows what they're doing. Preferably a surgeon, a plastic surgeon would be great, or even a derm surgeon who's operated on the nose. I'm a skin cancer surgeon, so I operate on the nose all the time because you really want to see the anatomy. Dermatologists who've been injecting for a long time, other injectors that have been injecting for a long time and that have done cadaver courses and that really know what they're doing, and not only know what they're doing, but know the signs of if something goes bad and what to do. So ask your questions, make sure you read their consent, make sure they're not sugarcoating it, and in the end, you will love it if you're a good candidate. So hopefully that was helpful. I'll see you guys later.